Hi, everyone. Welcome to ieso Conversations. I'm Kristen Sills, Director of Marketing at ieso. So before I introduce you to my guests today, imagine you live with a physical health condition. Your symptoms are so bad that you would be willing to give up a quarter of the rest of your life just to feel normal. That's what people with irritable bowel syndrome, or IBS as it's called, told researchers in one international survey. Just think about that for a second. To live symptom-free, they trade away a quarter of their remaining life. And when I read that, it stopped me cold. It underscores just how heavy these conditions can be to live with. And a lot of that weight, it's mental, not just physical. So today we're talking about the connection between gut conditions and mental health. We'll get into what the gut-brain connection actually is and why these conditions are so real, despite what so many patients are being told, and how getting the right support, physical and mental, can change someone's life. I couldn't be more excited about our distinguished featured guest today. Dr. Heather Ventura-Witcher is a gastrointestinal psychologist at the Cleveland Clinic. Her specialty is helping patients manage GI disorders and other chronic conditions through evidence-based behavioral health interventions, which we'll talk about. Her clinical and research interests include digestive diseases, dysautonomia, and medical trauma. Heather's super passionate about integrating psychology into medical care, also something else I'm sure we're going to get into. And she's also passionate about developing innovative programs that improve patient access and outcomes. So Heather, thank you so much for being here.
Yeah, thank you, Kristen. I'm really excited to be here.
I'm also joined by my incredible colleague, Alyssa Dietz. Alyssa is also a clinical psychologist and head of clinical strategy at ieso. She has experience herself working with GI patients when she was at the VA, but now spends her days working on getting mental health support into the hands of more people through digital health pathways, both the patients who can benefit from it and the clinicians who are working so hard to support them. Alyssa, thank you as well for being here today.
Really excited for the conversation. Thanks for the warm welcome.
We hear a lot about this gut-brain connection, or maybe you don't. But regardless, it's a thing. And we want to start there. So is it real? Is it something that people just like to say? What's going on scientifically, Heather? How do the gut and the nervous system interact? Explain it to me like I'm like a ninth grader.
Yeah, so this is absolutely a real thing. The way that I will often talk with my patients about this is we think about the nervous system having this built-in stress response. We've all heard of it. It's fight or flight. And unfortunately, for about 40 to 50% of the world's adult population, that fight or flight gets triggered by internal sensations and not just if there's a threat outside of their body. And so this often manifests as overreactivity in the nerve endings through the digestive tract. When we hear people talk about when their stress goes up, their GI symptoms go up, it absolutely does because of its impact on the central nervous system and how the gut is responding to those fight or flight signals.
Does stress itself cause it alone?
It works more as like an amplifier.
Okay.
I will often tell my patients, stress by itself does not cause these symptoms. If that were the case, 100% of us would have GI symptoms. But it does take information that is there at the site of the nerve endings and it amplifies it until it gets to a point where we can no longer function with it going.
So it seems like some people can then get caught in this cycle of like symptoms and heightened stress feelings and anxiety and nervous system activities on 11. How does that cycle work and why can it be so hard to interrupt?
One of the problems with the cycle is that it is impacted by things like our thinking patterns. It is impacted by things like our emotional responding, whether it's excitement, whether it's fear. And it often gets brushed off by medical providers. And this is where we unfortunately get that idea that these symptoms are in your head when things like thoughts and emotions and behaviors all work as amplifiers, same way as stress does. So one of the things that as a GI psychologist we really strive to do is figure out how we can help the body stop viewing physical sensation as a threat, and then also adjusting all of those other amplifiers so that patients can have a higher quality of life. The way that I normally will start with patients is I really want to make sure that we are calming down your nervous system, and then we can start addressing thinking patterns that may be amplifying what's there.
Yeah, I really like how you talked about that, Heather. And one of the things that I'd love to sort of just like double click on that you said, because I think it's a really great point, is, a lot of times when I have spoken to patients about this, when they hear fight or flight, they're picturing like, okay, this is what happens when I encounter a bear in the woods. But what they're not thinking about is what happens when you're facing continuous stressors, day in, day out, work, parenting, maybe taking care of your own parents, trying to figure out how you're going to make a schedule work, et cetera. And so having this conversation that it's not just these physical things. Of course, there could be physical stressors too, but there's also these sort of behavioral or environmental stressors that can trigger that response that, is not quite looking the same as encountering a bear in the woods.
Yeah. One of the things that I am really fond of telling my patients, our brains are very, very complex and also sometimes a little silly. They don't know how to tell the difference between there's a bear in the room with me and I have a pain in my stomach or I have a pain in my bowels. And so it treats it with the exact same intensity.
Yeah, sometimes even when this is a little off topic, but like after I exercise hard, it's important to do that breathing to calm down, to remind your nervous system that you're not being chased by a bear in the woods. What about the process of dealing with a new diagnosis of a GI condition? I think seeing a gastroenterologist is like the third most difficult specialist to see. You may be dealing with multiple tests, a years-long journey of getting to the bottom of what may be going on with you physically. Can you talk a little bit about the stress that's involved in that process and how that may also play into how this all gets wrapped up in someone's experience?
The really unfortunate thing with the medical system right now is that many times my patients will feel that they've been invalidated, not just by one provider, but by multiple providers on their journey. And a lot of times this becomes this internalized gaslighting of sorts, where I've had patients come in and sit down with me and say, I think I'm making this up. All of my doctors say my tests are normal. I think that I'm doing something wrong, and that's why I'm sick. And it's really hard to hear them talk about their journey that way, because it paints a very clear picture of the interactions they've had with different providers. I tell everyone, regardless of what the diagnosis ends up being, my biggest concern is I want to help them have a good quality of life, whether they're living with chronic pain, with chronic GI symptoms, with dysautonomia. I want us to find tools and strategies that help them actually get to spend some time not being a patient and getting to be a person.
Yeah, I imagine that being made to believe it's all in your head, you start to believe that, whether you're explicitly told that or kind of implicitly start to believe that, that's got to take an enormous toll. Alyssa, is that something you've seen not only with maybe GI patients, but any kind of chronic condition patient that you've worked with?
Yeah, definitely. There's a lot of folks who've been made to feel, like you said, either explicitly or via implication, that either it's in their heads or sometimes they'll say like, oh, maybe I'm just being dramatic. And, that's really an unfortunate position for someone to be in. It makes them question themselves. It makes them question their expertise on themselves and their bodies, on their symptoms, on knowing when to ask for help, when to escalate. And it can cause so many other downstream problems in addition to already having this sort of self-doubt, this self-questioning of, is this real? Am I making it worse than it needs to be? So on and so forth. So it's problematic just like in and of what it is of that implication. But then there's also these downstream implications of, not help seeking when they should for physical symptoms or other things like that they call into question their own judgment. And frankly, that's like the last thing that we want for folks.
And also too, if they've been referred to getting psychological care, for some patients, is it difficult for them to kind of wrap their minds around, well, why am I at a therapist? do you think it's all in my head? Like, why am I here?
That is the very first thing that I address with any new intake who comes in and sits in my office is, I want to clarify for you what GI psychology does. You are not here because this is all in your head. You are here because your brain and your digestive tract have somehow got wires crossed and they're not communicating effectively.
Yeah, I really love that you do that, Heather. That's a great way to start the relationship with them. Sort of related to that, one of the things I would do, and I used to work on a consult liaison service, so specialties from within a hospital would refer patients to me. For example, I remember I was working with this woman who had Crohn's, and she's like, "I'll be honest, doc, no idea why I'm here." And so, that is a very normal experience. And so one of the things I talked about with her is like, look, there's lots of things that we can talk about together. This is not all in your head. You are absolutely experiencing these things. And we also know that things like stress, anxiety, depression, when left unchecked, can exacerbate your experience and make it worse. We also know that folks who are, adjusting to this diagnosis or adjusting to the implications of the day-to-day life with it might have some questions about, what does this mean for my identity, who I am, how I move through the world? What does this mean for the plans I made about my future and what that looks like? So we can work through that together. And then we can also talk about if there are other sort of changes you want to make in your life so that you can thrive, you can live a life that is rich and meaningful and fulfilling. I want to support you in making those changes. And so helping them understand that there's menu of options of things we can work on together that have nothing to do with it's all in your head, I find can be a really helpful starting place for them to sort of understand how they might relate to us working together.
Yeah. And if I can add just a little bit to that as well,
Please do.
having them know anyone who has chronic health symptoms is likely going to have some anxiety surrounding their health and some depressed mood, because if you're too worried that you can't leave your house because what if you can't get to a bathroom? That's depressing. You're missing out on social interactions and doing things that you enjoy. So the other part of the conversation I'll have with patients is that depressed mood does not mean the same thing as like major depressive disorder. Anxiety and depression are normal reactions for having a chronic set of symptoms.
What psychological treatments or approaches do you find, Heather, work best for your patients, and why?
So the number one treatment recommendation for most disorders of gut-brain interaction is going to be gut-directed hypnosis.
Ooh, what's that?
It is a very specific type of, almost more like a meditation. It's very guided, where we are effectively slowing down that fight or flight response and then teaching the brain what signals we would like it to send out to the body. So rather than having a sensation in our stomach and our brain responds by saying there's pain and turning it up, we can actually have the brain start to send signals out that relax different muscles, that quiet the nerve endings. And then we talk a little bit about traditional therapies I think people have at least heard of, like cognitive behavior therapy. Or for myself, I use dialectic behavior therapy, or DBT, because both of these can help us adjust how we're thinking and how we're responding emotionally in certain settings. And in my opinion, they also give us the space to acknowledge that some days are going to be really hard and our symptoms are going to be there. That doesn't make us any less. It doesn't mean that we're failing. It means that we're making space and that we're practicing self-compassion rather than telling ourselves, I'm doing this wrong.
I co-sign enthusiastically everything that Heather has mentioned. Another approach I like to use is acceptance and commitment therapy, or ACT. And the basic premise here is that we are able to experience these periods of pain, of disruption, of anxiety, of worry, and able to move towards a life that is fulfilling and aligned with our values with those things on board. And so I find that can also be a natural fit for folks too.
Heather, I've heard about something called a boom and bust cycle for many patients with chronic GI conditions. What is that? And do you encounter it a lot?
This would probably be the number one behavioral thing that I run into with my patients. And it's this idea of when we're living with chronic illness, when we have a day that we feel great, we also have a tendency to say, I need to get everything done today that I've been putting off. So I'm going to overexert myself. And then the next day we wake up and we feel absolutely terrible. And then it may take us a couple of days to recover. And during that time frame while we're recovering, what is often going on in our head is, I'm lazy. I've got so many things I need to get done. How am I going to manage everything?
Or do you beat yourself up for overdoing it? Like, why did I do that?
Yeah, a lot of people do. A lot of people will kind of own, I did too much here. And I also had to get everything done. What was I supposed to do?
So how do you help them work through that and tell them not to overdo it and find that middle ground?
Everyone's favorite thing in the world is activity pacing. And I say that sarcastically because nobody likes it at the beginning. So we would often implement taking small breaks in between large things that we're trying to accomplish. The idea is if we're taking breaks preemptively, we don't run that risk of completely wearing ourselves out. So it may take us longer to do things, but we're not having to spend 3 or 4 days in bed recovering because we took breaks whenever we needed to. And I always roll this into, this is an act of self-compassion. We are not our productivity. We deserve to feel happy and healthy while still being able to achieve the things we want to do. And that, to me, is the big part of at least how I teach behavioral activation, is these breaks are not necessarily a break from the activity, but they are a break for us to be kind to our bodies.
Treatment is not linear or even the same for one person versus the next for anyone with a chronic health condition. Someone may have a flare, and that's expected if you're living with a GI condition in particular. It's not that that's not going to happen. It's that it will. And how do you kind of accept that and live the best life that you can, that's as joyful as you can through that? But how do you help someone make that shift though from, I need to make sure this never happens again to, I know it will. So now I know how to handle this, not if it happens, but when it happens.
So I am a big supporter of DBT in these instances. And there's a skill in there called radical acceptance. It is one of my favorite things to talk about because when you tell a patient you have to accept that you have a chronic illness, what they hear is, you're telling me to get over it. And so I always clarify, absolutely not. Acceptance doesn't mean we have to be happy about it. Acceptance doesn't mean that we have to stop trying to find answers or stop trying to find what works for us. It just means that we're accepting this is part of my reality right now. And that acceptance lets us pick and choose. Where do I need to go from here? What can I do depending on how I feel in this moment? So radical acceptance is a huge part of living with any chronic illness.
And Alyssa, what do you think about also, I'm thinking beyond the person themselves, but the way that they interact with others and how this impacts relationships with a partner or colleagues at work or friends. Talk about that piece.
Yeah, absolutely. And so the one of the things that I pull on an approach that Heather was talking about with DBT is there's a module called interpersonal effectiveness skills. And one of the things we do is we teach people how to advocate for themselves, right? Like how to speak to a loved one about what they need and be clear about what they're asking for and why. We also work on saying no. That can be part of that activity pacing.
It's a full sentence.
It is a full sentence, exactly. And so we'll work on saying no and holding that boundary, and related to that, how to set boundaries for yourself, how to maintain those boundaries about what you're able to do and what you're not able to do. And I think that proactive communication and giving people tools to make their communication even sharper, more clear, more direct, helps them to build that life that's meaningful, right? Like, I really want to be there for your birthday party tonight. I don't think I'm going to be able to make it because I'm experiencing a flare tonight. What if we get together next week and you come over and we, have a cup of tea and talk about how the party was? Finding ways to continue to foster connection and value and meaning, and being able to communicate those effectively so that the people in your support system don't read it as withdrawal or avoidance or like something's wrong.
The other thing, and I'm wondering, Alyssa, if you run into this, folks are very quick to pick up how to set boundaries with other people, but getting them to set that boundary with themselves. Of having to acknowledge, I can't do 15 things today.
Yes, it's definitely easier applied, I think, to others than to themselves.
So Heather, I know you see people in person, but we had COVID and that kind of shifted everything to online, virtual, teletherapy. Does gut-directed hypnosis work over a laptop, or must that be in person? Talk more about that.
I get this question all the time about the hypnotherapy and virtual. There was actually some research because of COVID where they looked at treatment efficacy and found that it is just as effective through a virtual format, and in some cases, even more effective, because people are much more likely to relax when they're in a comfortable home setting compared to I have to drive through traffic and I have to figure out parking and there's a lot of noise going on in the outpatient hospital and it's never really quiet. It is one thing that I'm really glad we got out of COVID, was learning that this treatment can be effective in a virtual format. And now it is available for a much wider population.
Yeah, it's definitely helped increase access. Alyssa, what about other digital forms of support are you excited about right now that you either have seen or are working on?
Yeah, no, I love this topic because people don't stop being people outside of their therapy sessions. And even though, we teach them skills, and the whole idea of pretty much all of the approaches that Heather and I have discussed today is to teach skills for people to use outside of the therapy room, out in their daily lives, sometimes things just get stuck or things cause them to forget the skills they learned. They need some help or support navigating using those skills. And so I really think that digital tools have such promise in this area because they can be available to folks, in the middle of the night when their eyes have popped open and their thoughts have started spinning and they're not able to sort of bring themselves back down. And other ways to support people in those moments where a therapist isn't available or wouldn't be appropriate, and allows us the ability to reinforce that skill building, help them troubleshoot, navigate, and then keep practicing, right? And, there's tons of research that shows that one of the best predictors of change is practice. And so if you learn about the skill in the therapy session with your therapist, but then you never use it again, it's not likely to be particularly helpful. Whereas if we can give folks reminders about what those skills are, provide them with some coaching about how to deploy it in a difficult moment, those are all things that increase the likelihood of those skills sticking around for the long term and thus being able to benefit folks.
Another related digital thing that has kind of recently come into everyone's orbit is our algorithms being flooded with like health and wellness content and influencers, right? I'm sure we've all seen it. It's certainly all over my algorithm, and it's probably tailored to like my age and gender. But Heather, as a clinician, I know you have some thoughts on these types of influencers and this content that we're seeing on like Instagram or TikTok. How do you feel about it? And especially how it's impacting and reaching younger people?
This is a topic that I often talk about with my colleagues. Because on the one hand, I want to be very transparent. Like some of the new tools and the new skills that I've started implementing in therapy with my patients have come from other therapists on TikTok. There is a beautiful way for us to have connections to other people that maybe we didn't know existed. GI psychology is a very small field. There's only a couple hundred of us. And so finding people who are trying different things through social media and they're finding what's working and what's not, it helps give us other resources and guidance. The flip side of this is I have had multiple patients come in or send me a TikTok that's come up in their algorithm, and it has been filled with misinformation, including things that are driving patients towards medications that they don't need or surgical procedures that are actually damaging and not helpful for them. So I always kind of err on the side of caution with my patients, where I ask them, hey, if you see something, let's sit down and let's talk about it. Let's actually look at what some of the research is showing. But I also know that that's not an available resource for a lot of people. And a lot of people make their decisions based off of what they're seeing online.
It's definitely tricky. I can see if you have nothing except your access to TikTok, that feels like a lifeline, and not everyone's so fortunate to be able to work with a specialist such as yourself to kind of set the record straight or really understand whether or not that influencer, that health and wellness advice is good for them or not.
One of the great things that social media offers people is that for so many folks, they feel very isolated. They feel very alone, like this is only happening to them. And so it can be incredibly validating to see that there are other people out there with similar experiences, similar symptoms, and that you're not alone, and that, there are other folks who've had this. And in some cases, it's role model is not the right word, but it's like they're able to see examples of people who are able to move forward towards a life that is aligned to their values in spite of what's going on with them from a chronic condition perspective. So, I love that for them. It's amazing that they get to see that. And at the same time, we have to teach folks about media literacy, about how to review information with a critical eye or ear, how to evaluate it, and also to understand complexity and nuance. Like just because something is an effective treatment for one person, you might have a very specific symptom differential or specific biology difference or whatever it might be. That means it doesn't generalize to you. And that's one of the reasons we look to the research. Heather talks about how she reviews it with her patients directly, is like, we can look at large groups of people amongst all of them. What are the trends of what works versus what doesn't, as opposed to like one specific individual. So when we look at larger samples for research studies, you can see patterns of what works and what doesn't versus what could be like a highly specific reason related to someone's specific circumstances. So all said, I'm not really sure if it's a net positive, a net negative, a net neutral, but it is nice to be able to have that experience of others who are, you can relate to. And also we've got to help folks develop the tools to parse what information they should be taking seriously and what is maybe to be a bit more skeptical about.
Agreed. So Heather, if we stopped treating mental and physical health care as separate, what would improve if we really did commit to doing this 360 holistic approach?
I think from a patient standpoint, we would see genuinely a decrease in a lot of symptoms across the board because we don't have that underlying stress that's just amplifying it continuously. From a system standpoint, we would also see far less overuse of medical appointments or messaging directly with the doctor or the doctor's office. A lot of doctors would then maybe feel less stressed, less burnt out, and would provide potentially more effective care for the patients that they're seeing. It surprises me every time that I go to work with how siloed, even at a place like the Cleveland Clinic, how siloed the different departments are. And it almost always leaves us looking at missing pieces rather than this doctor can look at the whole picture. We see patients get what we refer to as like hot potatoed around everywhere. And they're still not getting answers because we're not looking at the big picture of nutrition and mental well-being and physical symptoms and medications. And I think understandably, this means that patients are very anxious about what's going on. That anxiety of, am I ever going to get better, is very, very real. And for a lot of patients, this results in what doctors will sometimes perceive as doctor shopping. But really, it's them wanting to get a second opinion or have someone sit down with them and look at the whole picture so that they know what they're choosing to do is the right thing for them.
Alyssa, what do you think?
Sort of by definition, the way that our health system is that we have specialists. And so they have specialties, right? Like that is the thing that they are expert in, that they're best at understanding. They understand it to a depth and nuance that, would be difficult to hold across more than one specialty or a handful of specialties. And at the same time, we also know that the big picture really matters. Things like sleep, movement, nutrition, stress management, substance use, all of those things can have interactive properties on the whole health experience. And so being able to understand the whole profile of an individual and all of their behaviors, their biology, their medications, their symptoms, etc., I do think it could lead to better outcomes for patients. And I also recognize that that's an extremely difficult thing to be able to do.
One day, maybe we'll get there.
Fingers crossed.
Yeah.
Yeah. I mean, if I could on that, I I realize I'm getting into a little like futurism here, but I do think with technologies like machine learning and AI, I do think that's more possible now than ever before, because there are abilities to pattern match, to look at huge data sets and process them and derive insights in ways that we've never been able to do before. So I am hopeful that technologies like that will be able to advance our understanding of how all of these factors interplay with one another, the outcomes they lead to, and what we might be able to change in order to change the trajectory of what someone's experiencing.
Technology certainly has a role to play. It's changing by the minute as well. So we have to stay on top of it all and make sure it's done responsibly and done right, and not general purpose like ChatGPT, like for going back to the influencer thing, like, people probably going to ChatGPT to diagnose themselves, or Dr. Google, right? Like, so we want to make sure that this is done appropriately in order to do that.
Yes, all caveated with safety and privacy and ethical concerns appropriately addressed, but
100%. I just have one question remaining for the both of you. I'll kick it to Heather first. Put yourself in a room full of bigwig healthcare CEOs. Maybe you're on a yacht. No, just kidding. Put yourself in a room with healthcare CEOs, health plan leaders, policymakers are there. What is the one thing you want them to understand about the mental health side of living with chronic illness?
There's a lot of value in mental health services, and it often gets ignored. Focusing on mental well-being for patients should hold as much importance as focusing on medication and testing and general like primary care appointments. Currently, that is not the case. It is not viewed as important. That would be the one thing I would want to change, is that they understand the work that we do helps a lot of people, not just mentally and emotionally, but can also help reduce physical symptoms.
From the perspective of humanity, offering mental health support is important. People deserve to feel worthy, cared for, thought of, and like what they're experiencing really matters. And as if that weren't enough, which it should be, but if it wasn't enough, we also know that unaddressed mental health care leads to a host of so many negative outcomes related to physical health. We see more frequent hospitalizations, more frequent emergency room visits, higher rates of elective procedures of questionable necessity. There are worse outcomes. There's lower treatment compliance and adherence and persistence. There's the reasons for humanity that we should be doing this because it's the right thing to do for people. And it's good for business.
Yeah, you are in a room with business leaders.
Exactly.
And policymakers. So fair point.
Yes.
Well, thank you guys so much. This has been really illuminating, super fascinating. I know I enjoyed it, and I hope our audience did too. And it's been a very much needed conversation, I feel, as well. Heather, where can people go to find out more about you and learn more and get in touch?
The easiest thing would be to look at the Cleveland Clinic's gastroenterology department website. I am like one of 7 member team who works in GI psychology. So it's a good place to get to know all of us and our little subspecialties within GI.
And are you on LinkedIn?
Sorry, yes, I am on LinkedIn.
Great.
Still brand new.
Go find Heather on LinkedIn, guys.
Yeah, let's build up her connection count. Let's do it.
Alyssa, what about you? I'm assuming you're there as well.
Yes, you can find me on LinkedIn, as a matter of fact. And then you can also stay close to the work I'm doing by visiting ieso.ai.
Excellent. Well, thank you again, both of you, and we'll see you next time for our next conversation.